Hi, I'm Dr. Kelly Starrett of the Ready State. Oftentimes we'll end up meeting a patient who's in a part of their life process where they have chronic degeneration in a tissue. They've got something set up where maybe the osteoarthritis in their knee or their hip is really bad and they're not in a place where they can get some relief, or they're not in a place where they can have surgical result. And one of the things that we realize that we have available to us is the high frequency setting on H-wave. So typically, what we know about the high-frequency setting is that when we put that energy through a joint, through a specific tissue, we can run that thing for about an hour and then have some real instantaneous on-demand pain relief. That pain relief also tends to last for many hours afterwards. So the physiology is complex, but what's not complex is something really hurts, I can shut it down, give myself some relief, and then create, and this is the key part, an open window where I can then do some movement. Now, the problem when we have kind of chronic pain or degeneration in the tissue that my brain has become sensitized to is that oftentimes limits my movement choices or limits my ability to load or continue to occupy my role in the family. So what ends up happening is that we can then use the high frequency for 30 minutes to 45 minutes, sort of planning where we can shut down some of the overriding pain signals coming from the tissue that are interpreted as the brain as threat, and then that creates a window of opportunity for us to move. And that might be going to the farmer's market, that might be attending an important event, or it might be, hey, I've got this hour, my knee feels better, I'm going to ride the bike a little bit. And so what we see oftentimes is it's not always just about pain relief and on-demand pain relief. That can be important, but really is about ultimately restoring a possibility of movement. H-Wave, at the very core of its being, is a movement company, and the idea here is to facilitate movement or facilitate healing or facilitate relief in the body so that I can then go move, and that might be moving for exercise or simply moving in a way that allows me to occupy my role in my family or do my job or interact in my community in an important way. So again, 30 to 45 minutes, even 20 minutes of a high-frequency dose can have sort of lots of follow-along relief that creates a window of opportunity where I can then move when I may not have an immediate surgical or pharmaceutical intervention that allows me to do the same. So this is one of the ways that we like to use H-Wave in our complex patients, are people who are having pain that's limiting their movement.